Hello, I'm Dr. Sana, one of the doctors in the clinic today. May I confirm your full name and age, please?
Hello, doctor. I'm Lena Blake. I'm 17.
How may I call you?
Lena is fine.
Nice to meet you, Lena. How are you doing today? Are you currently studying or
Yes,
working?
yes, yes, I'm studying.
That's good to know. So, how are things at school?
Yeah, things have been fine. Thanks for asking.
Thank you. Lena, I'm aware of your situation. I understand you have been referred because you have had some concerns regarding your periods and you have undergone some testing, including the genetic testing. Is that right?
Yes, doctor, that's correct.
Lina, is there any specific thing that is worrying you today? Anything that you want to me to address first?
Yeah, I haven't started with my first periods yet. I feel like I'm lagging than most of the girls. So that worries me the most, doctor, that why this is happening, I want to understand.
I completely understand how that must make you feel. Lina, as we are meeting for the very first time, I'd like to ask you a few questions. Some of the questions may feel intrusive and personal, but rest assured, whatever we discuss will remain confidential. Is that okay with you?
Yeah, that's fine.
So, could you tell me more about your breast development and the development of hair in your private areas?
I feel my breasts are not that well developed compared to my friends, and I'm shorter than all of them. But I think the growth of the hair growth seems to be fine.
And has this issue affected you emotionally or socially?
I feel so embarrassed at times, yes.
That's completely understandable. Do you have any other brothers or sisters?
I have a younger sister. She has got her periods already.
And is there any other family history of delayed periods or puberty, particularly in your mom or other siblings?
No, no, nothing.
I hope you don't mind me asking, are you currently in a relationship?
Yes, I'm seeing someone.
And are you sexually active?
No, not yet, but we are planning to.
Otherwise, are you fit and well generally?
Yes, I am.
Any medical conditions like heart conditions, thyroid, diabetes, kidney
No,
problems?
nothing.
Have you ever been troubled with repeated urine infections?
No.
Anytime you notice low energy, excessive tiredness, breathlessness, or your heart is racing
No,
fast.
no, no.
Okay. And have you ever had any problems with your hearing?
Hearing, no,
Any surgeries in the past?
nothing.
Any medications that you are taking regularly, particularly hormones?
No,
Have you ever received growth hormones as a child?
no,
Any allergies?
no.
Don't mind me asking, do you smoke or drink alcohol?
No, I don't do any of that.
Any recreational drugs?
No,
Whom do you live with?
with my parents.
Are they well supportive?
Yeah, yeah, they are.
Okay. It may sound inappropriate, Lina, but just a routine question. Have you ever thought of having children in the future?
I don't know. I am too young for that.
Yeah, I understand. So, Lina, let me examine you in the presence of a chaperone with your consent to check your weight for height ratio, your blood pressure in both hand, arms, as well as examine your chest and listen to the heart sounds. I would also need to look at the intimate areas like breast development and growth of your hair around your pubic area.
That's fine.
Thank you so much, Lina, for cooperating. So, before I explain the results, may I ask if the GP has explained anything regarding your genetic testing?
No, he just told that I need to get these tests done because I haven't had my periods yet. Yeah.
All right. And Lina, I can see you are here today alone. I have a lot of information to give you. Do you like anyone to be called with you?
No, I prefer, no, no, I don't prefer that.
Okay, that's not an issue. Thank you. So, Lena, I have confirmed your reports with your name, age, NHS number. They indeed belong to you. Before I explain the diagnosis, let me give you a quick background. So, all of us are made of a genetic materials that are contained in a tiny thread-like structures that we call chromosomes. We normally have 46 chromosomes, and girls mostly have a chromosome pattern of 46XX, which means they have got two X chromosomes. So let me draw it here and show you that this is your womb, and these are the fallopian tubes, and there lies the ovaries. Girls with 46XX pattern, the ovaries develop normally. The ovaries then produce eggs and the hormones like estrogen hormones, which is responsible for development of breast, normal changes around puberty, and onset of periods during the teenage years. I'm afraid I have a difficult news to give you, Lina.
Oh my God, doctor, what is it?
Your genetic test has confirmed that you have a Turner syndrome. Have you ever heard of it?
No.
So this is a genetic condition, Lena. As I mentioned, girls have two X chromosomes in Turner syndrome. One of the X chromosome is either completely or partially missing. Because of this, the ovaries do not develop fully and they do not produce enough of the estrogen. This explains why your breast development has been slower than expected, and also you have not started your periods yet. I'm really sorry to be
Oh my
giving you
God.
this.
Oh my God, doctor, what do you mean? What are you trying to say? Are you trying to say that I'm not a girl?
Absolutely not, Lena. I want to reassure you that you are a girl and nothing about these results changes this fact. It does not define who you are. It is certainly not does not make you any less of the girl or a woman. This is not your fault. Rest assured, there is nothing that you or your parents did or did not do to cause this. It happens very early in the development, even before you were born, and unfortunately, we do not know exactly what is the cause of
Yeah,
this
but
problem.
what should I do now, doctor? How will I get my periods? Is there any treatment available?
Yes, that's quite a valid concern, Lena. So, coming to that, first of all, we need to reassure you that you are not alone into this. We have a team of doctors, including the multidisciplinary team, including my consultant gynecologist, specialist nurse, hormone specialist, endocrinologist, heart specialist, psychologist, and counselors, support groups, and if needed, fertility specialist. As far the periods is concerned, so we need to replace the estrogen in the form of hormone replacement therapy. This will help in your body going through the normal puberty. Your breast development will increase further, and you will have regular periods. It will also protect your bone, brain, and heart health.
Oh,
Okay,
okay.
am I
That's
clear
good.
so far?
Yeah, that's good to hear, doctor. Yes.
Yes. So this treatment will also protect your long-term health. And there are a few other things. I don't want to scare you, just want you to have all the information about this situation, this condition. Turner syndrome can be associated with other health conditions like thyroid disease, diabetes, heart conditions, kidney problems, hearing problems, reduced bone develop strength, and also high cholesterol. So we need to assess you closely. Sometimes the gut issues like celiac disease and autoimmune conditions where the body immune system mistakenly attacks its own tissues. So we monitor your health regularly. We will arrange some investigations, including heart, ultrasound, echocardiogram, bone density scan for the bones, hearing assessment, kidney and liver functions, thyroid and diabetes screening. If everything remains stable, most of these assessments will be repeated after every 3 to 5 years, depending on the findings and the advice of the specialist. Are you with me so far?
Yes, quite clear.
Would you like to know about your fertility options in future, Lina?
Okay.
Because of Turner syndrome, you may find it difficult to conceive naturally as the ovaries may not produce enough of the eggs. When you plan for pregnancy in the future, we will refer you to the fertility specialist to discuss your options, which generally include three options in the form of a test tube baby, which we call as IVF with donor eggs, where your partner sperms and the donor eggs will be fused together, and the embryo will be transferred into your womb. The other is surrogacy, where if the pregnancy is considered not safe for your health, then another woman can carry the pregnancy on your behalf. And the other third option is adoption. Before considering pregnancy, we need to look carefully into your heart situation, do the cardiology assessment, and only then you will be allowed to carry out the pregnancy. But please remember, you are not alone in this. We have the counselor support groups for the Turner syndrome support groups. We will put you in touch with them. And this condition does not define who you are, and it's not your fault. Am I clear so far? Any questions?
No, you're quite clear.
I will document everything. I know it's a lot to go through, and I will arrange an appointment with my consultant, write back to your GP, and we can continue to support you together.
Thank you,
Anything
doctor.
else?
No, thank you.